September 2016, the Americas achieved a significant milestone. All of North, South, and Central America had successfully eliminated measles. It was the result of a decades-long immunization campaign. While other parts of the world still had cases, this milestone meant it was no longer circulating in the Americas. And that's why the recent imported case of measles in Guatemala is a cause of concern for all of us in the Americas, including Belize.
The threat is because measles is a highly contagious disease and it's potentially life-threatening as well if you do develop the complications. The threat is it can spread quickly and it can spread especially to infants, especially younger than 5 years old. They will be the vulnerable population for us.
Now, aren't most Belizeans covered with the vaccination against measles?
Well, Belize, the Ministry of Health introduced the single measles vaccine in 1986. In 1996, we introduced the MMR, the measles, mumps, rubella. In, I think, 1997, we did a campaign to catch the people who did not get the triple vaccine. The targets are set at 95%. So we still, sometimes in some areas, aren't achieving that 95%. So we're asking moms, dads, parents to take their kids out at 12 months for the first MMR and at 18 months for the second MMR.
If you haven't gotten around to vaccinating your child, or if you are unsure of your vaccination status, you can still get the MMR shot. It is available at all public clinics and is included in the routine vaccination schedule.
In years gone by, millions of children died from measles. In the region of the Americas, from like the 1980s to the 2000s, countries started to introduce the vaccine, and that saved a lot of lives because the kids were then immunized against measles. It did not spread the way that it used to in the past, so it's a very significant vaccination that you should get, and it has saved lots of lives. It's a virus, and the more common severe complications are deafness, blindness. Encephalitis is a common, well, is one of the more deadly complications, and that's inflammation of the lining of the brain. Children can develop severe diarrhea, severe dehydration, sepsis, multi-organ shutdown. So those are some of the, I shouldn't say common complications, but those are some of the complications that may occur with measles.
Currently, the United Kingdom is facing a measles outbreak. Other European countries are also seeing cases as well, which means that there must be heightened awareness in this region.
When we look at even this imported case presently, and we look at improving our vaccination coverage for the 12 months and 18 months, but we're also looking at the public, not a mass campaign to vaccinate, but looking at the ports of entries and the people who work at these ports of entry. So they would also be a vulnerable population because they would be the first people that the infected tourist or person would come in contact with.
There are no current cases of measles in Belize. The last reported case was in 1991. So since this is an unknown illness for many, Dr. Diaz explains the signs and symptoms to look out for.
We have two case definitions, slightly different. The first case definition is a person who presents with fever. Usually the fever is continuous for more to 3 to 4 days with a rash. Now the rash starts from the face or neck and work its way down to the trunk, associated with, we call it the 3 C's. Coryza, which is runny nose, runny eyes, like cold symptoms, cough, or conjunctivitis. The second case definition is a patient with fever, again 3 to 4 days, and the rash may not be there, with the 3 C's, so a patient with fever with either cough, coryza, or conjunctivitis, but the significant difference in the second case definition is that they have to have a travel history to the UK over the last 30 days.
If you have any of these symptoms, especially if you haven't been vaccinated and recently traveled to an outbreak area, visit your nearest healthcare center immediately.